Nose is the center of the face, and that dictates what a person looks like. The personality, the character is dictated by the nose. I love it. I look at it as an art form because it's the center of the painting, center of the face. I'm really, really passionate about it. That's my life. I've been doing it for 40 years. I've done over 10,000 noses, and these are the frequently asked questions.
What are the different approaches to a nose job?
The nose job can be done both scarless, that's my technique, and with open rhinoplasty, where you have scar at the bottom of the nose and you peel the whole skin, you reconstruct the framework of the nose, both the cartilage and the bone, and you restitch it. In my opinion, scarless is the way to go for as many as 95% of the noses, because you're able to accomplish everything from the nostrils.
Why do you prefer scarless?
Scarless has been my technique for the last 40 years, and it's where you can accomplish the subtle refinements without inflicting a scar. Healing is much faster. Day 6 I can take the bandage off and you can go out in public.
Can all noses be done scarless?
Not true. There are noses with bulbous tips, and particularly with an indent here, those noses do not lend very well to sculpting of the tip with scarless approach, and they should be done with a little bit reconstructive approach and open approach, and revisional rhinoplasty should be done open so that again you can repair the damage.
How does one choose the right rhinoplasty surgeon?
So one has to be really an artist and has to have tremendous surgical experience to do the rhinoplasty, and what's great that it should never look like it was done.
Can you fix the breathing without changing the shape of the nose?
Great question. I get that asked all the time. A lot of the athletes, basketball players, football players, hockey players, boxers, they break their noses and they're not interested in changing the shape of the nose. So I can just do the septoplasty and the valve repair with spread grafts, and you don't need to change the shape of the nose.
Does it hurt?
Strangely enough, this is not a painful operation. The only discomfort in this operation is when you do the septoplasty, and for 48 hours you need sponges inside the nose to catch the mucus, and so most of my patients don't even take any pain medication.
Why do rhinoplasty prices vary so much?
So you have to pay for the experience and combine that with the artistic ability of the surgeon to provide the best natural looking nose. I keep saying natural is the most important. It cannot have any surgical telltale signs.
Do you need to break the bones with every nose job?
Not true. I would say when you do the septoplasty and the internal valve repair, you don't need to break the bones. And that's why the healing is really fast. And even in the rhinoplasty patients, when you're just doing minor refinement, you don't need to. So I would say statistically speaking, about 50% of noses I break the bones, and the other 50 we don't have to.
How quickly can I exercise after surgery?
I typically take out the bandages on day 6 or 7, and I think you can start exercising immediately thereafter, as long as there's no impact and no contact sports. Those have to wait for about 5 weeks, because any bone in the body, if you break it, it takes about 5 weeks to heal.
How quickly can I fly after surgery?
The day of surgery is counted as 0. Day 7 you can fly back.
How long does the nose take to fully heal?
I think there's 3 stages for healing of the nose. Day 7, when the bandage comes off, you can go out in public and there's no issues. Should there be a little bit of residual bruising, you can cover it with makeup. Second stage is 5 weeks when the bones are healed. And third stage is most of the swelling disappears, approximately 70% of the swelling disappears by 1 year. So that's the third stage. Nose continues to heal beyond that also.
How quickly is recovery from septoplasty?
Again, doing the scarless way, septoplasty and the valve repair can be done quickly and the patient repairs quickly. No bones are broken, so the patient can go about their normal business in 5 days.
Is a deviated septum the only cause of difficulty in breathing?
No, the septum is one of the main causes. So if there's 10% deviation, 30% deviation, and where the deviation is in the front or behind the septum, it has to be fixed. But even more important than that, after fixing the septum, the cartilage which you obtain, the broken pieces of cartilage, should be utilized. It's called recycling. Utilized as a spreader graft to open up the valves. That's the same effect as a breathe right effect. That's number 2. And the third one is enlarged inferior turbinates, and they get enlarged because of the dryness in the room, particularly in our sleeping environment. It's very dry. We need to have a coolness ultrasonic humidifier in our bedroom, right adjacent to our head of the bed, and the mist should be falling on your face so that you can keep your turbinates in normal shape.
Why do celebrities come to you?
Celebrities are very concerned not to change their faces. Their faces are known. The world knows their faces through the movies and through other activities they perform. So I perform conservative finesse rhinoplasty, where I am very targeted as to what needs to be done so that the camera loves it, and yet it's not discernible that the surgical nose job has been done.